Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is February 5th, 2021. As always, we start with our COVID-19 statistics. Worldwide, we have over 105 million cases and over 2.3 million deaths. In the United States, we have over 27 million cases and nearly 470,000 deaths. Let's start with some COVID-19 vaccine news. First off, Johnson & Johnson has applied for emergency approval for their vaccine in the United States. That means that most likely by the end of this month, we'll have a third vaccine available. So that's great news. We do want to clear some stuff up. Last week we talked a little bit about Johnson & Johnson's vaccine, saying that it was only 66% effective at preventing COVID-19. We did mention that it was up to 85% effective after 4 weeks at stopping severe illness and death. But we may not have explained it very well as far as why it's important that we still have this vaccine and everything. So let's clarify things a little bit this week. No vaccine is 100% effective for anything at all out there. No, measles, tuberculosis, nothing. No vaccine is 100% effective. In fact, the over 90% effectiveness for the Pfizer and Moderna vaccines is pretty much unheard of. It's really good. That effectiveness and the speed at which they were developed is actually really amazing. People have called them miracle drugs because of that. When we started thinking seriously about vaccines at the beginning of the pandemic, most scientists believe that any vaccines that we created would probably only be around 50 to 60% effective. So the reality that we have right now is so much better than that. Every single vaccine that we've seen is at least 60% effective, excepting in cases of some variants. Then they drop down a little bit lower than that, but still really good. And we don't actually need 100% effectiveness in our vaccines. Like I said, there aren't any other ones that are 100% effective, and we still control, measles and everything else really well. So what we need to do, what's the most important part here, is we just need to make the COVID-19 virus basically irrelevant in our lives. If it just becomes the same as, say, a common cold, like everyone that gets COVID-19 is asymptomatic or just has mild symptoms, we don't care. Who cares if you have the sniffles for a couple days and then it's gone? It's no big deal at that point. As long as we don't have any other long-term symptoms either, like long-haul COVID, then it's fine. We don't care. So what we really need to do is have vaccines that work against those death, hospitalizations, severe illness, long-haul COVID symptoms, things like that. And so far, from all the tests we've done on the vaccines we have, they're all amazing. We've got 5 right now that are either approved in the U.S. or nearly approved. That would be the Pfizer and Moderna. Those are the ones already approved. We've got the Johnson & Johnson that we just mentioned that should be approved by the end of this month. We've got the AstraZeneca one, which has been approved in other countries, but not yet been approved in the United States. Most likely it will be approved by either the end of this month or maybe the next. And then we also have the Novavax vaccine, which also will most likely be approved either towards the end of this month or sometime next month. So all of those do really well against preventing death and severe symptoms, regardless of what the actual percentage is for the total prevention of any symptoms or any getting of the virus at all. So there are other vaccines around the world that also do well, but they're not likely to make it to the United States since we already have quite a few, we've got agreements for getting quite a few vaccines already. The agreements that the U.S. government has basically covers most of our need. We may need a little bit more, especially with second doses and things like that, but we're pretty set in the United States. So right now we need to make sure that other countries also get what they need. One vaccine that we've mentioned before is the one from China. Another one this week that made news was Russia's Sputnik vaccine. It's 92% effective according to reports. And so we need to make sure that every country has access. We can't just assume that, we've got it here in the United States, we're going to be fine, we can let the rest of the world just, deal with it on their own. It doesn't work that way. We're way too interconnected nowadays. Just as the virus itself came from China, most likely, we're still kind of unclear on that, but that seems to be the case. Just as it came from China, it hit other countries, Italy, other parts in Europe, hit the United States, South America. It's gone throughout the world. Just like that has spread throughout the world, it's the same way with anything else. If anything happens, it could come back to us. Variants, things like that. We got variants from the UK, variants in South Africa, variants in Brazil, all sorts of variants around. Any of those could possibly have issue or cause issues with the vaccines that we currently have. So we need to have worldwide cooperation to get this working right. It's not enough just to say we can take care of our own selves, you guys take care of your own selves. No, we need to make sure that everyone gets the vaccine so that everyone can be protected. If everyone's protected, the virus, the SARS-CoV-2 virus that causes COVID-19, it won't be able to get a hold anywhere so that it can replicate. And when it's replicating, you get the mutations that cause the variants. It won't be able to do that because there won't be anybody to act as host. And so we'll be able to stop those variants. It's extremely important that we get the vaccine spread throughout the entire world. We need to develop worldwide herd immunity, not just in small pockets like individual countries or states or anything like that. So while the world races to get everyone vaccinated, we need to make sure that we're still following the CDC and WHO guidelines, namely wearing face masks, avoiding large crowds, practicing social distancing, and washing our hands. Those are things that, regardless of whether vaccines work or not, those things work. They just do. Of course, we don't like the side effects of them, a little bit of isolation, not being able to go out and do stuff, having to wear the masks, which are, for the most part, uncomfortable. We don't really like those things. And so we'd love to have these vaccines that will help us go back to normal. But in the meantime, we know these other things work. So let's do them. Let's do them so that we can have a better life in the near future. We don't want to have to, stretch this out forever. That's not fun. So let's just follow those guidelines. So with the large crowds, speaking of that, we've got I guess it's an unofficial holiday coming up here this Sunday. Lots of people are interested in the Super Bowl. And it's one of those things that people often gather together in large crowds or even in small crowds in houses, get your neighborhood together or whatever, families. We want to avoid that if we can. Please don't gather for Super Bowl Sunday. We saw a definite spike in cases after Thanksgiving, after Christmas. We're just now starting to get over that. Like we mentioned last week, we've kind of plateaued on those cases and now we're going down. There's been a 45% decrease now since that time. And so it's awesome. We're doing great. If we gather for the Super Bowl, we're not going to do great again. We're going to get those spikes again. It's just like any other holiday, whether it's official holiday or not. The gathering is what matters. So please try virtual gathering for it. Or, if you're like me, don't really care about football, just don't watch it. If you don't get together, don't watch it. It doesn't matter. But if you do care about it and you're planning on watching it, please do not gather in large crowds. Please don't. Stay home. Don't gather in large groups. If you gather in small groups, make sure that you're wearing masks if you're around people not of your immediate household. Make sure you're practicing social distancing, washing your hands, etc. We need to keep this under control. We're doing great. We just need to keep going. So we usually talk about face masks on our weekly reports. This week's no different. We just have one bit of news about face masks this week, though. Ford, the Ford Motor Company, has designed a new N95 mask design that's clear. It's completely clear, and it just has a few little N95 filters in it. And this will definitely help for those who need to see your face, for example, those who are hard of hearing or deaf. This can definitely be a huge boon for that. So they're not the first ones to create a mask that's clear. We talked about another clear N95 mask a couple of months ago. But we need as many as we can get, because individual companies can only produce so many. So the more people who design these, and who knows, maybe the designs on some of these are a little bit different. We'll find out some are better than others. Maybe we can combine some of the designs to get an even better one. Any innovation is good. We want to have more scientific innovation here to help us face not just COVID-19, but anything else. Like we mentioned a few reports ago, the flu is almost non-existent this year in the United States because we've been taking all these different precautions like face masks, social distancing, etc. This stuff works for pretty much all diseases that can be transmitted between people. So let's keep it up. That's kind of the theme for this report is keep it up, keep it going. Let's keep pushing. We're just about to the end here. We just need to keep it up for a little bit longer. So one thing we want to talk about this week is a side effect to the COVID-19 response. And it deals with hand sanitizer. As good as hand sanitizer is, we've seen some issues with it. For example, the methanol in some of them and other things like that. Another side effect we're seeing with that is that in young children, we've had more eye injuries due to hand sanitizer than previous years. Still not very many, but it is quite a bit of an increase compared to before because it used to be almost non-existent. The problem here, or I guess the things to watch out for when you have your kids with you around hand sanitizer is first, avoid using hand sanitizer on any child under 2 years old. They just don't know how to deal with it. And that might have to extend up to 3 years old or whatever, depending on your own children. You know your children, if they know how to deal with it, good. If not, please don't use it. Use soap and water, or if you're out on the go, use maybe a wet wipe or a baby wipe, something like that to clean their hands. For older children, make sure that they're rubbing their hands together well. Make sure they're getting rid of all the wetness from the hand sanitizer. They're getting it rubbed into their skin and everything, letting it dry off. We want to make sure that that's like that because a lot of times what happens is that older children will forget that they've got that hand sanitizer on and they'll rub their eye and boom, you've got a minor injury. It's mostly irritation. Usually it's not serious, but it can be serious if they have a lot of sanitizer on their hand or if they're particularly sensitive to the ingredients. So let's try and get that rubbed in really well. Third, for in many public situations, you've got hand sanitizing stations set up in many stores or malls, etc. And those hand sanitizing stations are often at the eye level of children. And so, first off, keep an eye on your children. Don't let them go and do it on their own without you keeping an eye on them. But second off, also try and make sure that they don't get too close to those sanitizing stations. Because if someone else, like another adult or something, is using it, because it's at that eye level, it could splash right into the kid's eyes. So it's best to just avoid those hand sanitizing stations unless you're right there with them and able to help them use it properly. Before we finish this week, I do want to talk about a couple of new studies on gut bacteria. We've been talking about this quite a bit, since the beginning of this year and a little bit into last year. Gut bacteria can affect many aspects of our health. It's not just our gut that is affected by gut bacteria. Some new studies show that gut bacteria, the composition of our gut bacteria, can actually affect things like Parkinson's and Alzheimer's. They've shown that certain gut bacteria can actually cause or at least aggravate Parkinson's and Alzheimer's symptoms. And so they're still doing research on this, as pretty much everything that we talk about here is, but the evidence is pretty strong. In fact, it's really strong. There's an article in the links below about that. Please look it over if you're interested in that. But gut bacteria really does play a big part in our overall health. With that in mind, there's another study that came out this week that shows that a bad diet when you're a child, diets full of junk food, highly processed food, things like that, can actually affect your gut bacteria in such a way that it affects your health all the way into adulthood. Thankfully, by changing your diet to a healthier diet, one with more plant-based stuff like whole grains, fruits, vegetables, things like that. Doing that can actually change your gut bacteria to help get rid of the bad health symptoms that you may be experiencing. Unfortunately, it's really hard to change your diet if you've grown up eating a certain way. So it's a lot easier just to raise our children eating healthy food. I say easier. I've got kids. I know it's not always easy to feed them healthy, but it's easier to do that than to deal with health problems down the road. So let's try and focus on eating more healthy foods, avoid the junk foods. Not to say you can't have them at all, but limit them, have them in moderation. If we do that, we'll raise a healthier generation. So thank you for watching the Plain English Public Health Weekly Report for February 5th, 2021. As always, we've got links below the video that deal with stuff that we weren't able to get to and more information about stuff we did talk about today. I'm Richard Greenland, and you have a healthy weekend.